And so the first one is the 3-day prior hospitalization waiver. And that one provides that temporary emergency coverage for skilled services without the 3-day stay, right? And again, this is temporary. It would be lovely if this was more of a permanent thing, but definitely temporary. And the whole intent behind this is really about preserving hospital beds for the greatest need, right? It's about freeing up that space for folks, and the capacity is such a big concern with this pandemic. And so if you think about it, the different scenarios that are possible here, you might have somebody that's coming to you from the hospital and they've only been in the hospital 1 or 2 days. And so they're coming directly. So again, they still can go on they can still, if they meet the criteria, they can still be covered under Medicare in your facility, despite only being there 1 or 2 days. They could also come to you directly from the emergency department. So, somebody goes into the hospital and they deem that, this could be safely taken care of elsewhere, but not quite maybe home. You could bring them directly to your facility from there, and again, still access their benefits. They could come to you from the community. So maybe after they've had a call with their physician and the doctor says, no, the emergency department isn't the right place for you. Let's see about getting you admitted to a skilled facility where you can get the care you need, since you do not need, acute level of care. And then also think about the patients or the residents that you have in your long-term side, parts of your units. And they may need, maybe they've come down with symptoms, respiratory illness, or other conditions that would warrant skilled level of care. Again, no need to have that 3-day hospitalization to qualify for the benefits. The second piece of this is one that I think is causing all of us a lot of confusion. And unfortunately, CMS has not done a great job here in terms of really clarifying this one yet. Others they have done addressed in FAQs, and so we're watching to see if we do get some more additional clarification here. And so the intent of this is to provide additional skilled nursing facility benefits for a Medicare beneficiary who at the time of this disaster had exhausted their skilled benefits in their current benefit period, and I highlighted this because I think this is an important component, and was in the process of establishing a new benefit period. Okay, so think about your resident or patient that maybe went home even, and they had their rehab and their skilled care, and they went home, and 25 days later end up with respiratory symptoms or whatever, and maybe they get checked out in the ER, but there's no admission there, and they recommend nursing facility care. Okay, they were in the process. They've maybe only been home 20-25 days, right? And so they didn't get their 60-day wellness period, right? And so, but they still definitely have a skilled need. There's likely this person could be covered. There's a lot of confusion, as I mentioned, on this, and I think we're all, like I said, still very unsure of this one. But if you're going to use this, be very, very cautious and make sure you have clear clear guidelines on this, because it's not intended for those individuals like residents with a tube feeding, right? Everybody just says, can I just keep them on? Can we go another 100 days? And no, that they've been clear about that is not the intent there. So again, we're going to be watching to see if there's some additional clarification, but basically what the key thing here is in the process of establishing a new benefit period.